Vic Snyder, Georgia Republican Congressman Tom Price. Ms. Snyder, let me go to you first. Doctors are complaining bitterly. I mean, the AMA may support this in Washington, but only 18% of doctors are members of the AMA to begin with. And a lot of these guys, when you read this long article from Investors Business Daily, it's a highly respected, accurate poll. They say increased mandates, lower pay and Medicare reimbursements, and less freedom to practice. What are we going to do if primary care doctors walk away?
Well, if I believed how you posed the questions there, I suppose I would consider quitting too, but that's not the reality of what's in the House bills. It's certainly not going to be the reality of what gets passed and signed into law. The bills that will come out of the House will have a substantial increase in Medicare reimbursement. That's one of the reasons doctors like the bill. And if you are from a rural area like mine, one of the big pressures that you have on rural hospitals is the number of uninsured patients who show up, and yet they get admitted. We're going to take care of them. But the rural hospitals have to eat the bill. 98% of people without health insurance pay nothing to hospitals. And the third component is if you're a doctor, gets up in the middle of the night, goes down to the emergency room to take care of a patient, there are going to be tens of millions of more people who have health insurance. So what we have the last few days is battling polls. NPR has a poll that says 70% of the people like the public option. This most recent poll comes out and says doctors would consider quitting. I don't know why a doctor would consider quitting if his reimbursement rates are going to go up and a higher percentage of his patients will have health insurance, and it'll be basically a market-based system. So,
well,
you know.
Okay, but all right, there's another side to this. Dr. Congressman Tom Price from Georgia, welcome back to the show.
Thanks, Larry.
Look at declining enrollment in medical schools. That's another point that comes out of this article. 159,000 fewer doctors than we need out to 2025, according to one study. Primary care physicians are the ones that are leaving us. And here's another one. I just want to look. Here's where the shortages are. Dermatology, neurology, urology, vascular surgery, obstetrics and gynecology, plus, of course, the primary care physicians themselves. Now, Dr. Snyder says it's going to be okay because they're going to get reimbursed. As I understand it, and you tell me, Mr. Price, Dr. Price, I thought Medicare was going to be ripped and ravaged to the tune of $500 billion, which means more below-market payments to doctors, which is exactly the problem, sir. Please comment.
No, Larry, you've identified the right problem. The workforce issues are huge, getting the number of doctors that we need across this land. And the fact of the matter is it's not just reimbursement, and you can tick up reimbursement a little bit, but it's the regulatory regime, it's the oppressive oversight that occurs for physicians, it's the liability risk, the malpractice liability risk. It's all of those things rolled into one, and a federal government that says we know best, we know how to tell you how to take care of your patients better than you know. And that's, as a matter of fact, what's in the House bill. And so all the bright young folks across this land look at medicine and they say, oh my goodness, that's not the kind of life that I want to live. That's not the profession that I want to go into, which is very, very sad. I'm a third-generation physician. Our son had no desire to go into medicine, and we're not unique. A lot of the young people in physician families across this land have said, no way am I going into that. I've seen my dad or I've seen my mom suffer under the kind of oppression that the federal government puts on them in the practice of medicine, and say, we're not going to do that. So the workforce issues are huge. We can address these things, and it doesn't take the government to run things or the insurance company. You can put the patients in charge, which is the positive way to do it that would make it so that, once again, physicians would want to practice their profession.
Well, I come back to what Dr. Flyer said, the dean of the Harvard Medical School. In order to give more patient choice, he says one of the first orders of business should be to give the tax shelters to the individuals rather than the businesses. I mean, he just wrote a piece in the Harvard Medical School website. Congressman Dr. Vic Snyder, let me go on more.
Let me respond to Dr. Price there.
Okay.
He outlined problems with his son not going into medicine, those kinds of issues. That's the current system. That's the current system of uninsured patients. We do have a workforce problem, absolutely. The House bills will have something to deal with this workforce issue. But we've got a choice of problems, Larry, what we want to do. We can continue doing what we're doing, have the number of uninsured go up, the number of underinsured going up, the number of businesses that can't maintain their premiums, the number of people with health insurance now that we think we like and we're paying our premiums not being able to afford it. We can continue that system, recognizing that we have workforce issues, or we can go to a system when doctors will be better adequately reimbursed by Medicare, which is what the House bill does say Dr. Price. And we will have more people with health insurance, with private health insurance. Right now, they can't do that. I mean, I just don't understand why a doctor going to a rural hospital, going to an emergency room in the middle of the night like I used to work, wouldn't like to have a system where Medicare reimbursed better and you had a higher proportion of your patients
but can I throw this out?
being reimbursed by insurance.
Can I throw this out? I know, Dr. Price, you want to get in. And by the way, Dr. Snyder, I totally appreciate your point of view. I'm just throwing this stuff out because I don't know that I have all the answers, but some of these things are extremely troublesome when I read them.
Well, Larry, I think there's a lot of arguments that need to be thrown out. But that's
let me just put this on the table. I'll let Dr. Price go first. Congressman Dr. Price versus Congressman Dr. Snyder. Look, if you have a shortage of doctors now, which is what all these studies say, Dr. Price, and by the way, there's a related shortage of nurses, how the heck can you accommodate 47 million more uninsured? That is one of the things that comes out of this Investors Business Daily study.
Sure.
What's your response to that, please?
Well, the fact of the matter is it's not just the government that needs to be in, or could be in charge, or the insurance companies. Again, we can put patients in charge and make it so it truly is a system that responds best to patients. In Massachusetts, when they instituted the individual mandate and the employer mandate, which is included in the Baucus bill and included House bill, what they saw were more individuals being insured, but then they had huge workforce challenges where people are waiting longer and longer and longer in order to get appointments to see their doctor or to see specialists. So the fact of the matter is that we've got to take care of the things that we can take care of, keep the good things about our current system, fix the flawed things like you've been talking about, Larry, the insurance challenges with either portability or pre-existing or being able to have competition in the purchase of health insurance. And we can do all of those things without raising taxes or without putting the government in charge. So there are positive solutions that we can put on the table and ought to be voting on. In fact, we don't have to put the government in charge or insurance companies continue to have them in charge to solve the challenge.
I mean, Dr. Snyder, I want to grow the doctors. I want to grow the nurses. I want to grow the hospitals. I want to grow the private health care sector because I think it's America's leading economic growth and job-creating industry. I want incentives. I want tax cuts. I want deregulations, but I don't see any of that coming, sir.
I want you to listen to what my good friend Dr. Price just said. He said that if we make the changes that we'll say the Waxman bill, if it were to come out as it is unchanged, that because we would have so many more people with health insurance, that they felt, so many more American families felt comfortable that they could go to see the doctor without going broke, that we would not have enough doctors. Is that not a good problem for this country to have than what we have right now, which is people staying home, denying themselves care, denying their families care, literally dying because they don't have health insurance?
Vic,
Tom, you and I need to go to work on these workforce issues. I know it is true, Dr. Price. I know it is true, Dr. Price.
The fact of the matter is you can insure individuals through the private system so that they're the ones selecting their insurance, not the government.
The Waxman plan helps Americans buy in the marketplace from private companies.
But not interstate. Not interstate. It's not true deregulation.
Not interstate.
Let's work on the interstate thing. I talked to Henry Waxman about it today.
I know. You agree with that. Look, I just go back to this key point, gentlemen. Everyone agrees. All the studies agree there's a shortage of primary care doctors. That's your old-fashioned physician. We got to work on that.
But let us not work on that, Larry.
Let me just read this. There's a growing shortage. Dermatology, neurology, urology, vascular surgery, obstetrics, and gynecology. You know, gentlemen, here's what bothers me. Americans are going to be so sick they're not going to be able to work, produce, invest, and grow the economy.
Larry,
our health's going to deteriorate.
don't solve the problem of not enough doctors by keeping patients away. That is not the way to solve this problem.
But they want
we all know that.
They want 30% higher wages. I mean, this was a study.
Nobody's saying that. You know the solution doesn't require putting the government in charge.
The American Academy of Family Physicians, okay, they did a study. They say that primary care doctors need a 30% pay increase from $160,000 a year to $200,000 a year. By the way, specialists get $300,000 a year. Dr. Snyder, that's not in any of these bills. They're going to cut back on what doctors make, their revenues and their profits. That's not in the bill.
Yes, it is. In Henry Waxman's bill,
a 30%.
One of the issues that deals with not 30%, is a substantial increase in the Medicare reimbursement for doctors, and then on top of that is a 5% increase for primary care.
Dr. Price, I got to give you the last word. I'm just flat out of time. Dr. Price,
those are already below cost, and the fact of the matter is we can fix it by making put patients in charge, not government or insurance companies.
I got to leave it there. Congressman Dr. Snyder, thank you, sir. We really appreciate your point of view.
Good topic, Larry. Happy back.
Thank you, sir. Congressman Dr. Price, as always, great to see you.